Mr. Smith. I'm Violet. I'm going to be your student nurse. I'm going to close your curtains for privacy. Can you verify your name and date of birth? Great, thank you so much. I'm going to wash my hands and put on gloves. Today we're going to be doing NG tube insertion, and this is to assist in feedings or any suction we may be doing. This procedure can be kind of uncomfortable. Would you like any analytics? Anesthetics? Okay. Before we begin, I'm going to set out my tape to repair. I'm also bringing in all of my supplies with it. For this procedure, again, I'm going to need to sit you up in bed and raise the bed, so I'm going to do that now. Before we begin again, I want to ask that you want any anesthetics, because it can be kind of uncomfortable. No? Okay. To start, I'm going to give you this emesis basin in case you're feeling any nausea at any time. And we're going to start by measuring the NG tube. So I'm going to take this from your nose to your earlobe, down to your xiphoid process. Okay. I'm going to go ahead and mark that this is as far as I need it to go in. Could you go ahead and blow each side of your nose and tell me which one is easier to breathe in? Okay, sounds good. I'm first going to apply some lube, 2 to 4 inches, on my applicator. And we're going to begin. Can you tilt your head back for me? Thank you. Now at this time, I'm going to ask if you could sip out of this water. I'm going to finish. Okay, that's as far as I can go for my mannequin. I'm going to lightly secure this on the nose before I check the proper placement. Now, at this time, I'm going to check the that it's in the right place. With the basin.
Are you doing the lube? Yeah, the bed got freaking stuck, so I'm sitting here with a base and you
Okay, so that is under 5, so it is in the right placement. I can also check with my tongue depressor. I could also get an x-ray so that I can get it approved by a physician.
I'm not trying to take forever.
To confirm, now that I know it's in the right position, I'm going to secure it down. Before I continue, I'm going to measure how far from the nose to the end of my line to know how much I have out. So this is about 92 centimeters, which is longer than it would be. It would go longer into my client. Now that it's fully in my client, I'm going to either put it up to a suction or I could do a feeding. I'm also going to make sure I put a line here with a marker so I know if there's any movement. I would do my feeding by holding this with gravity. And now I can flush with water. I could also hook up to a suction with this attachment to my suction. Okay. that will finish the installation of your NG tube. So I'm going to pin it here to your shirt so we can use it later. And I'm also going to tape this to your face so that it is out of the way for you and more comfortable. We're going to perform oral care every 2 to 4 hours to keep your mouth moistened. Let me know if you need anything. Okay. Now my NG tube is fully inserted and I'm going to be demonstrating how to take it out. Hi, Mr. Smith. Today we're going to be taking out your NG tube. So I'm first going to perform hand hygiene, raise the bed, put my gloves on. Would you like any anesthetics before we begin? Okay, great. I'm going to unpin this here. And before I begin removing, I'm going to check that it's the proper placement by suctioning some of the stomach products out and testing the pH. The pH is under 5. And now I'm going to flush with normal saline or water through my line. Okay. I'm gonna place this down now and gently remove this. If you would like, if you could, can you take a deep breath and count to 3? And I'm gonna remove this as I can. 1, 2, 3, hold your breath. Awesome, you did a great job. I'm gonna fill this up and dispose of my used products. Thank you so much, Mr. Smith, for letting me help you. I'm gonna lower the bed. Head of the bed. Before I leave the room, I'm gonna check how much suction there was. There's 0 at this time. Thank you for letting me help you, Mr. Smith. I'm gonna wash my hands before proper hand hygiene and open your curtains if that's how you would like them. Hope you have a great day.